My career path had a couple of surprises along the way. I started out by going to medical school and started a residency in surgical subspecialty training and developed a life-changing and career-changing allergy to latex. This is the type of allergy where you could go into anaphylactic shock, similar to a bee sting allergy or a shellfish allergy. And this required me to rethink my career path, of course, and to try to find a way to move out of direct patient care and into more of a research and policy career. And so I discovered a medical specialty called preventive medicine and completed that program, and then spent time, I would say 8 years or so, doing mostly administrative work at the federal and local level for government agencies. For example, I worked on the Healthy People Initiative when I was in DC, and at the local level worked at the Los Angeles County Department of Public Health, running their performance improvement program there. And what do these have in common, you might ask? They're centered on data and integrating data for decision making. And I find that aspect of my career very rewarding. A typical workday for me is highly variable. And this is mostly because I have combined administrative work with research work, and I'm about 80% administrative, 20% research at this time. So what is a typical day like? I might be called into my CEO's office to give her advice on a medical question that she has. Then I may go off to an off-site government or professional association meeting to build partnerships for future projects. And then maybe spend time writing a research brief or policy brief as well. So overall, never a dull moment. The most important training that I think one could have to move into a position like mine would be to look at combining both training in clinical medicine or in a healthcare focused field, and then also integrating in population medicine or population health training. So I am board certified in preventive medicine after completing medical school, and then in addition I have a master's in public health degree. But in addition to the formal training, I really feel that the time I spent working and living and doing health policy in Washington, D.C. was a critical element. In fact, when I work with interns or medical residents or give a talk at a teaching institution, I always recommend that anyone who's interested in doing health policy work spend some time working and living in Washington, D.C. The most satisfying aspect of my work is to be part of a senior management team that's really focused on exploring and implementing big systems change programs. But the flip side of that is also that those changes can take years, if not decades, to see progress. And there's times when politics will trump science and the timing isn't right to move forward. That's definitely something you have to have patience and understanding for in this job. We're finally moving into an era where there's data that's available at the population level, within clinical care systems, and ideally within the public health system as well. Look at our services, track progress, and really assess the impact on total population health. I do see the clinical care system rapidly moving in this direction, whereas the challenge is to really find the funding and support for building the data infrastructure within the public health system. For example, electronic laboratory reporting, immunization registries, and syndrome surveillance have received support and are moving forward, but we need to be able to expand that type of data surveillance capacity into the leading causes of death, which are chronic diseases and, of course, the related risk factors. Right now, when public health's approached, we often don't quite know what data we want to collect or need to collect, and we just have to do better than that.